today to the FIP, Reducing Inequities in the Health and Pharmacy Workforce, the Importance of Maternity and Parental Leave Policies. I'm your moderator for this meeting. I'm Carleen McMorr and I'm a pharmacist. I'm a podcast host and producer for the Australian Journal of Pharmacy. I'm one of the FIP DG10 leads and I'm based in Australia. So just letting you know that this webinar is being recorded and live streamed via YouTube. The recording will be available on the website www.events.fip.org. You may ask questions using the question box provided. You are welcome to provide feedback to webinars@fip.org and to become a member of FIP at www.fip.org/membership registration. We're going to be discussing the reducing inequities in the health and pharmacy workforce, the importance of maternity and parental leave policies. The event objectives are: the first is to explore the challenges faced by women in the workforce related to maternity leave and its impacts on their careers. The second is to raise awareness about the importance of maternity and parental leave policies in promoting equity and equality in the health and pharmacy workforce. The third is to discuss best practices and innovative approaches to maternity leave policies that can ensure fair and inclusive practices in the health and pharmacy sector. The fourth is to identify strategies and policy recommendations to bridge the gender gap and promote equal opportunities for career advancement. And the fifth is to foster dialogue and collaboration among industry professionals, policymakers, researchers, and advocacy groups to drive positive change. So the event agenda includes welcomes and introductions, the introduction to FIP EquityRx program, the presentation from the panelists, so Dalal Hamoudi Halat, Aman Dole, Lucinda Main, the Q&A section, and then closing remarks. So we've got the 21 FIP development goals, and tonight we're focusing on development goal number 10 for equity and equality. So for equity and equality, number 10, WDG10, the FIP goals. There are three umbrellas that are encompassed under the FIP development goal 10, equity and equality. The first is the workforce and educational element. The second is the practice element. And the third is the science element. The goal of the FIP EquityRx and FIP Development Goal 10 is to leave no one behind. So the FIP EquityRx is FIP's equity and equality program, and it supports the progress and implementation of FIP Development Goal 10, locally, regionally, and globally, beyond gender and diversity balances, extending to equity in access to care and all that this encompasses. So the FIP EquityRx is a large program encompassing many unique areas of work, all of which come together to support equity and equality for all. And some of these program areas include FIP Women in Science and Education, Gender Equity, the Gender Pain Gap, Maternal Health, Health Literacy, and Vaccine Equity. I wanted to highlight appreciating all mothers, especially those experiencing humanitarian crises. So today's panelists are Dalal Hamoudi Halat, so the Common Year Coordinator, Academic Quality Department, Qatar University at Qatar. We have Aman Dole, who is the Head of Professional Belonging and Engagement for the Royal Pharmaceutical Society, Great Britain. And we also have Lucinda Main, the Chief Executive Officer for EMRITA, American Association of Colleges of Pharmacy in the United States. So I'd like to introduce the first panelist today, Dalal Hamoudi Halat, so the Common Year Coordinator. Academic Quality Department, Qatar University, Qatar, and she'd like to share her presentation with you now.
So, hello everyone. It is a pleasure to be with you here today. Thank you, Carlin, for the introduction, and I'd like to thank the International Pharmaceutical Federation to join me, to invite me to be a part of this event for today. Another shout out after Carlin to all women out there, especially mothers who are in humanitarian crisis. In this part of my presentation, I'm going to shed a light for some time on the FIP initiatives for women in pharmacy science and education, maybe highlighting some of the initiatives that Carlin has just pointed out. And then I'd like to shed a light on the evidence which we can give to women returning from maternity leave in order to make their life easier and to empower them. So actually, to start on a global scale, empowering women has always been a global, have always had a global perspective. And despite the strides that have been made to bring women into equality, still many gaps remain. In the UN Sustainable Development Goals since the year 2015, equity and equality or gender equity has been one of the goals, and it aims at bringing all women and girls on equal terms to different population to empower them and make them available and empowered in the different strides of life and across different sectors. In parallel to this, the International Pharmaceutical Federation, as we can see in the next slide, has also implemented an alignment with the UN goals. So as Carlin mentioned, the FIP Developmental Goal 10, which sheds a light on equity and equality, has long been sought by FIP since the year 2020 when these development goals were launched. And it focuses on the need for women and girls to be empowered and to establish equality, specifically in the pharmaceutical workforce and the pharmaceutical leadership. So these concepts have been highlighted. And also, as we can see in the next slide, FIP had promoted this in the initiative of FIPWiSE, which I had the pleasure to join since it was initiated in the year 2020. So at that time and during COVID, FIP initiated a group of active women in pharmacy science and pharmacy education to start this movement at that time. And it started by empowering women from the center and the margin in order to show their full potential and to reduce inequities that they might face in terms of pharmacy education, leadership, and research. I invite you to visit the FIPWiSE in order to learn more about this initiative and to learn how women can be empowered. And I'd like to mention that this initiative does not, although it is initiated for women in pharmacy science and education, but it goes above and beyond, probably for women from the different runs of life. Beyond the FIPWiSE, or among the initiatives by the FIPWiSE, and as we can see in the next slide, FIP has promoted the issue of gender pain gap. And maybe this relates to our event today since we're talking about maternity. So during the Civil Congress arranged by FIP in the year 2022, this report on gender pain gap was discussed, and it involved the insight boards of numerous practitioners, leaders, and women in pharmacy science and education who highlighted the issue of gender gap pain and the fact that it is not really addressed in pharmacy education and practice. Relevant to the gender pain gap, it was described that literature mentions that women may be stereotyped in their responses to pain. It has mentioned also that women sometimes overemphasize or report pain inaccurately, and this is a general reporting we see in women from different cultures. Also, the FIP report has noticed that there are inequalities in pain management, and of course, this would affect the quality of care. So I invite you as well to read this report on gender pain gap. This report aims at eliminating the gender pain gap, or in other words, closing the gender pain gap, and highlights several actions that can be taken in order to improve the quality of care of pain for women. So this is a brief introduction about the FIP achievements in this regard. And in the next slide, I'm going to shed like a little more light on the role of women in leadership. Actually, there have been a slow progress and many barriers towards the advancement of women role in leadership in pharmacy as well as in other fields. So this is not limited to pharmacy, science, and education, but it extends to different STEM areas as well. The difficulties are not limited to women on maternity, but to women in general. So the outcomes from what we are going to discuss today may apply not only to maternity, but also to empowering women above and beyond. So actually, according to statistics, and despite that the fact that women make over 70% of the healthcare workforce and have been described for many of their achievements in healthcare, in patient care, and in leadership, we see that the numbers reflecting leadership and research roles are much smaller. For example, women still make up just to 25% of healthcare leadership positions. We mean by this the C-suite positions, only 25% of permanent dean appointments, according to US statistics, speaking about US academic pharmacy. Only 30% of the NIH funds for research are granted to women across pharmacy schools. Women get only 13% of national pharmacy awards. And actually, and this is very sad, more than 70% of science, technology, engineering, and mathematics laboratories have male PIs. And women are 20% almost less likely than males to earn the title of a PI. In terms of funding, the startup funds offered to women are about $500,000 less than those awarded to equivalent colleagues from males across the same domain and the same rank. And also nearly 20% fewer women appeared as authors on COVID-19 related papers in the previous years compared to women on the same journals. And this highlights the pressure that the pandemic has done on not only mothers, but women in general, and the household duties that women are assumed to take as a gendered part of their responsibility. So actually, as we go across these numbers, we tend to say that we have to transcend from a world where these numbers reflect the role of women into a more open environment where women can be given like more rights and more and can contribute to better advancement of science and education. I'd like to share now one positive practice toolkit which has been developed by FIP, as we can see in the next slide. So FIP has developed a toolkit for positive practice environments for women in science and education. I invite you to visit this toolkit on the FIP website and also to read the related article, which has summarized what type of positive practice environments in the workplace can be practiced in order to reduce stress and anxiety and empower women into their leadership positions. This toolkit was prepared by a panel of women working in pharmacy science and academia, and is divided into several chapters that can showcase key practices to improve the status and the role of women. I'm going to shed a light on only one of these practices, which relates to work-life balance in the next slide. And if you visit this toolkit, Chapter 5 in the toolkit talks about positive practice environments. So what do we mean by these positive practice environments? This toolkit delves deep into how can we promote a better environment for empowering women in pharmacy science and academia, and note that this can apply also to women returning from maternity. So for example, flexible working hours, flexible deadlines, nursery and elderly care schemes, as these are duties assumed to be more gendered in many cultures, maternity leaves, paternity leaves, and special leaves, allowing flexibility such as working from home, avoiding the 8-hour working day and the 5-day working week. So it's a bit different from the traditional working environments. Sharing of jobs in order to share responsibilities, divide the tasks, supportive programs for family and for employees, as well as revised labor laws in order to prevent the extension of working hours for women. So I invite you to look into this toolkit and have an idea about how practically we can improve the practice for women. Moving on, and if in the next slide, and if we go over the evidence-based literature in the interventions aimed at supporting women, we find that a checklist approach, or in other words, an independent approach which is not interconnected, does not usually result in success of interventions aimed at supporting women. In order to support women, this should be an interlinked approach or a network approach, whereby we have several factors or several key players in order to empower women and support them. This does not start with organizational process and does not end with leadership development, but should be organized all along. So organizations should start by reducing the gender balance and by promoting family-friendly policies. While doing this and while trying to overcome the culture of gendered experiences for women, organizations should also raise awareness and engage everyone, including men, in promoting and publicizing gender equity and in fostering support for women. The traditional masculine concept of leadership should be challenged, and women should be promoted or engaged more in leadership positions in order to empower them and help them to establish their full potential. Next, women will require mentors, whether returning from maternity, whether returning from a personal leave, or whether women on the day in and day out working activities. Mentoring is required. Actually, as we get senior, we receive less mentoring and less feedback, and this could affect women in terms of their job progression and their professional development. So formal and informal mentorship is very important to boost productivity. We should consider even the advanced male mentors to mentor females, or females who have been across a more senior position, and this would be especially effective for young women pursuing the early stages of their career. Also, and beyond mentorship, leadership is needed, or leadership development is needed. So developing, so capacity building of women in terms of leadership and expanding their participation in different managerial and leadership positions is very important. This will build capacity in women and resilience to be able to navigate different responsibilities in the workplace. So according to evidence, such interactive or interconnected intervention is much needed and could be very useful to empower women in terms of practical steps. However, I would have also to say, and as we mentioned in the next slide, that such an approach will always require that we seek feedback and we seek assessment and evaluation. So always assess how women are progressing across their careers, always measure and report the progress being done, always acquire and review talent from women and also design for them new roles. In some cultures, there are problems that are not diagnosed in terms of the gendered responsibilities for women. It is a must that these problems are diagnosed, interventions are done, and a feedback or a reassessment is done again. Also, so all interventions done should be measured and should be monitored to see their effectiveness. And for women who really do have high potential or show potential merit, they should be formally recognized, because recognition always results into more success and more implementation of empowerment for women. So next, I would like to end this on a nice note. So in the next 2 slides, we will describe very briefly what are the interventions needed for women returning from maternity. So the challenges for women returning from maternity can be related to family responsibilities. How can organizations respond to that? They can promote flexibility. They can provide efficient childcare schemes in order to accommodate these women. They can foster non-traditional working environments such as remote working, and they should avoid excessive working hours. Another challenge faced by these women is if they have administrative duties and if they have service load. It has been reported in literature that many housekeeping duties, even at work, are given to women, such as organizing events, such as dealing with students in terms of academia. These are tasks women are found to do statistically more than men, although they do not contribute much to promotion or to job advancement. So in this case, it is advised that we have as a society or as an organization to reject the societal stereotyping of women as caretakers and of men as leaders, and to encourage both sides to take both tasks. We should always prioritize, simplify, and reduce the lower priority tasks from the workload of women. This is a group of challenges. Another group of challenges in the next slide is to look at the research and promotion challenges for women who return from maternity. So a maternity leave should be considered, and as such, the research and promotion requirements for women should be flexible and should be revisited. For example, flexible extensions for research proposals or flexible deadlines for grants should be given whenever convenient, and also accelerated promotions should be given for female distinguished faculty on equal terms with males in order to boost their productivity. For research funds, capacity building of women and encouraging them, especially when they are still junior, in order to acquire funding and to write successfully granted applications are very important, and also empower women to be better and to promote and publicize their research, because this reflects positively on their ability to move on and continue forward after returning from maternity and on a general term. So this is what I had to share about the gender challenges and how to mitigate them for women. I thank you so much, and I'm happy to take your questions at the end of the presentation. Thank you.
Thank you so much, Dalal, for your presentation. I'd like to introduce Amanda Dole. She's from the Head of Professional Belonging and Engagement from the Royal Pharmaceutical Society of Great Britain. Amanda, I'd like to welcome you to do your presentation now. Thank you.
Thank you, Colleen. Again, also thank you to FIP to inviting me along to have to this very important discussion. So I'm going to be providing some background and updates from Great Britain and the work that we've been doing at the Royal Pharmaceutical Society around the Parents and Carers campaign that we've been running for the last year or so, really focusing on the need to improve care for parents and carers in the workplace. So if I can have the next slide, please. Oh, we can skip this one, the next one, thank you. So as part of the wider inclusion diversity work that we've been doing at the Royal Pharmaceutical Society, we've made a commitment to supporting parents and carers within the workplace as part of the work that we've been doing and the surveys that we've ran, and also the workshops that we've held to co-collaborate with this piece of work. Being a parent and a carer, pregnancy and maternity status in particular, was recognised as one of the top 3 barriers to working in pharmacy in the UK. And that's because it can be a reason to slow down a woman's career in pharmacy, but also devaluing the time parents spend with their children. And that's because of our society's ingrained culture around pregnancy and maternity. And I know that's reflected globally as well. And women do take on more of the caring burden. And so actually, if it's going to affect anyone, it's going to be affecting women in the workplace. So as part of the campaign and the work that we've been doing, we wanted to ensure that the policies and guidance reflect the additional care burden that women take, but also reflect the modern day family unit that people might now be experiencing and living in. And sometimes even the words pregnancy and maternity can be quite binary in a way. So we just wanted to make sure we're being inclusive in our approach and intersectional in our thinking. What we want to do is see an increased number of individuals working flexibly and working equally in the workplace. And we also recognise that as part of this work, there is something called a sandwich generation, where you're a parent for your children, but you also may be caring for older parents and with an aging population. So we also recognize that actually being a parent can coincide with being a carer, or you may also have caring responsibilities which have very similar needs as being a parent in the workplace. And so we want to make sure that we're better supporting people who have caring responsibilities as well. And within all of this, we want to make sure that men feel supported to share leave and work flexibly to introduce and welcome new family members into their lives. It's something that we have seen that the caring burden falls on women, and that's because the policies and the guidelines that exist are focused predominantly on the woman and the person obviously undergoing the pregnancy. But actually we need to be better at creating more family friendly policies and sharing that burden across the partnership. And so a lot of the work that we've done has been built on by talking to members within the RPS in the UK, making sure that we're taking on their lived experiences and hearing the barriers and the challenges that they're experiencing and the things that they would like to see in improving these things in the workplace. So then for the next slide, again, it was just to kind of establish who do we mean when we talk about pregnancy and maternity in our Parents and Carers campaign. And we really wanted to take a very broad intersectional perspective on that. So this can include traditional pregnancy and maternity, but also people who might be needing to take adoption leave. Is it easy for parents to take time off? Or do people understand what is needed if you are going through an adoption process and everything that's entailed from the beginning of starting an adoption process right through when you get the child? Same-sex couples or non-binary couples, sometimes the language and the way that we think can be quite heteronormative. So we wanted to make sure that we're, again, broadening that perspective. Thinking about shared parental leave. So there is statutory parental leave in the UK. Parents, so I suppose fathers are allowed to take 2 weeks off as statutory parental leave, but there's also discretionary parental leave that organisations can do more than just the 2 weeks. And so, you know, are we enabling a better family-friendly policies for our workplace? If you're experiencing fertility issues, if you're having to do additional appointments or undergoing IVF, or maybe you may have lost a pregnancy, we want to make sure that we're encompassing people, because it can feel, again, very just focused on undergoing the pregnancy once you've got pregnant, but actually there's everything that might go before that, and the experiences and the challenges that will be affecting people in our workplace, and then also difficulties throughout that pregnancy, people who may have lost children, and the impact that also has on their partners and not just on the individual experiencing it. The feedback we also had was about the significance of the role of the partner. So, you know, some people weren't able to support their partner in attendance of appointments, and actually you do want that support. So how can we make sure, again, that the appointments aren't just seen for women to be going by themselves, but getting that additional support from their workplace, if they're from their partners' workplaces as well. General attitudes within pregnancy. Again, from all the work that we've done, we heard about the negative attitudes within pregnancy, directed at people who are pregnant, assumptions that are being made and microaggressions that people may experience. So we wanted to include that. And then obviously there's a bit about people coming back to work. You now have a child that you will need to look after. So it doesn't just end once the baby is born, but actually you now have a full-time child that you need to be taking into account. And how do you navigate work around coming back to work, especially if you've taken a year off, having an extended period of time off? It can be quite destabilizing, and there is a transitional period that we need to support people. And then once you're in work, what flexible working options are there? There are, we have changed, the government has changed in the UK that you can ask for flexible working right from the beginning, from day one of employment, which is a change in policy for the UK. But again, is that something that people are aware of and that people are asking for right from the beginning? So in our campaign that we've been thinking about in the UK, we really wanted to make sure we're capturing everyone that might be under that umbrella. Next slide, please. So what have we been hearing through the campaign? And it's very similar to what Dalal has said in terms of the negative experiences and the challenges that people have said that they're experiencing in other parts of the world. So there's negative experiences and discrimination. So from being pregnant, people might assume that, you know, that's it now. You have decided to have children and therefore you don't care about your career. And they've kind of pigeonholed you into a particular group. And so they may not be thinking about giving you opportunities or giving you a chance in going for those leadership roles, or a fair chance in those opportunities. And there's also assumptions are made about people's age and whether they're going to go and have children, or if they have children bearing age, how that can affect assumptions. And one experience that was shared with me was a young South Asian female wanted to buy a community pharmacy, and the owner wasn't willing to, a franchise wasn't willing to give it to her because he assumed she was going to have children and who would look after the pharmacy. So there's all these negative assumptions and discriminations that are being made right from the beginning, just based on the gender and assumptions. And there's also assumptions once you're back at work, if you're working part-time, that you're not taking your career seriously, or that you're distracted, and that can affect career progression. People don't see people in senior leadership roles doing it part-time, and so they don't feel like those opportunities are there for them. So we really need to work on thinking about what options are available and what we can be doing. Another challenge was about actually being allocated enough time to attend appointments. So if you have your maternity appointments or fertility appointments, some organizations, some individuals felt that their organizations only gave them enough time to go, and actually in the UK particularly, you might be allocated a time slot, but that doesn't necessarily mean that you'll be seen at that point, and things get delayed, and so you feel like you're always rushing back from your appointment, or you're running around. So again, it's making sure we're thinking more holistically about the experience that individual's having. A lack of empathy and understanding, particularly from line managers who may have not had this experience themselves, or again, a view where, well, I've had to go through it, so actually you'll be fine because you can cope. So just having more understanding and empathy for individuals. As I mentioned, flexible working is something that we're entitled to ask for in the UK from day one of starting employment. However, it can really vary, the support for flexible working can really vary depending on different organizations and cultures that you're working in. And I know it can be very difficult. So for example, in community pharmacy, it doesn't always lend itself to working flexibly, but it is thinking about what we can offer in a creative solutions manner in how we can work and support women wanting to stay and work in pharmacy and contribute fully. Again, lack of flexibility around appointments and challenges with fertility, going back to that lack of understanding. And there's one thing that's probably come up a couple of times, is actually feeling that you need to have reached a particular point to start in your career to start a family. So you might be holding yourself back from starting a family from a particular role in case you think that actually I can't do that role if I'm going to go and become pregnant. And we heard that a couple of times from some chief pharmacists who had become pregnant, perhaps incidentally, once becoming chief pharmacist, but they may have second guessed whether they would have gone for that role if they'd already had children. So people might be holding themselves back from particular roles, thinking that they can't do both. And again, that comes down to that culture and people not making assumptions about people's drives and motivations if they want to have children. Working part-time, so if you come back part-time, you might not know what to expect, and actually sometimes you still have to, you're expected to do the full-time job in a part-time capacity. So again, thinking about how we can support mental health and well-being in the workplace so that people don't feel overwhelmed in undertaking their roles. When you come back from maternity leave, there is an increased mental load. You have your children to think about, and you know, leaving work on time as well as doing the work. So how can we make sure that we're supporting women in the workplace that have this increased mental load, and making sure that we're aware of that? So putting a meeting in at child pickup time obviously is not appropriate. So can we be thinking about what adaptations we could be making into our work day? And then unrealistic expectations from line managers, people who may not have had this experience, expecting you to come back just as you were before you went on maternity leave. So you've already had an extended period of time off, but you've got an additional person to think about now. You might not be able to commit to all the extra hours that you were doing and all the workload. So again, it's making sure that we are training our line managers to know what to expect when people are coming back from maternity leave. Next slide, please. So again, going back to the maternity leave piece, if changes have happened, it can be a difficult transition. Things might be different, roles and teams might have changed, and so we need to support people in navigating that time back when you're coming back from maternity leave. Thinking about even the paperwork in the UK, sometimes it is a lot to fill in just from an admin perspective, and if you've not had to do it before, you might miss things that you're entitled to, and I'm sure that's the same elsewhere as well. And so thinking about what we can do to support people, and if you have a human resources department, they might not be the most forthcoming, and how can we work with individuals? Not anticipating you not being around. So if you are going on a maternity leave, there might not be a reduction in the workload, or there might not be a formal handover process. So there might be some thinking that you need to do as an individual in taking that initiative, because people just might not have thought about it around you. And again, coming back to the managers who might not have that experience or understanding if you're going through a difficult pregnancy or being a carer. When we have heard, and this has come up quite a lot, that people come back and they feel there's a real lack of confidence in their ability when they come back from an extended period of time, particularly from maternity leave. It can be very destabilizing, and it can make them want to not come back at all, or consider changing a career because they feel they're out of touch, or they're not coping, and they're not working to this, the standard they perceive they were before, and they feel there is a real transition period about that, and we need to be better at recognizing that, and we're not just throwing people back into the deep end. And how can we use mentors and coaches and people who've gone through this to build confidence back up, to make sure that we're making the most out of people back in the workplace. And again, related to that, people feel that there's a stigma if you're not coping coming back to work. People might feel that you're not capable, and they've labeled you because you're not instantly back to where you were before. And so again, that there's a real concern about ability and being seen as not being able to cope, because everyone copes. And I think that's one thing that's definitely come through all of this work, that compared to other pieces of work around disability or racism, everyone's a parent. It feels like everyone's a parent or a carer, and so some of these challenges can be overlooked in the workplace because you just cope, and everyone should cope. So actually we need to be taking more time and being more supportive to people in the workplace. Next slide, please. So really thinking about those challenges and barriers, and then putting a real positive element of actually what do we have that enables us to promote more equal opportunities and address the gender pay gap, and having more women in the workplace in those senior leadership roles, enabling that to happen. So within organizations and teams, we need to develop a much more open, flexible working culture, where actually it is the norm to be able to work flexibly and or part-time. So actually removes that stigma of working part-time and not being considered someone that doesn't care about their career. And in doing that, you're actually going to be more likely to attract diverse candidates in the roles, because they feel like they belong and that they feel like they are wanted. And that needs to be encouraged from the top down, really. If you see your leaders, your senior leaders undertaking senior roles, part-time and being successful, it's going to encourage more women to want to do the same. We need to be thinking about providing specific support for working parents. So are we providing coaches or mentors? Are those conversations happening when people come back to work, when we're setting objectives and having our one-to-ones? Are we offering that support proactively? Are we helping people navigate back into the workplace and make that transition effectively? And are we sharing role models and case studies? And that was a big piece of our work that we really wanted to promote, members of our profession doing the jobs part-time and being successful. And you know, sometimes that view is you can't be what you can't see, but we want to demonstrate to people there are people doing it out there. We need to have more of this best practice in the workplace. Organizations need to make sure that their policies are family friendly, and encourage flexible working, and ensuring that both men and women can benefit from having a child in the workplace. Because actually, if you're able to take 6 months paternity leave, then you know a woman can, the mother can come back on from maternity leave sooner if they wish, and they, you know, and have that much more fairer balance. So how are we making sure that they're equitable across all groups, and also thinking again from that intersectional piece about the different challenges that different groups may experience, additional barriers that if you're a woman of color, perhaps with a disability, are we making sure all of these policies are inclusive of all groups? We do need to provide line managers with additional support, make sure they're equipped with the knowledge and skills to help women in the workplace coming back from maternity, during their pregnancy, trying to get pregnant, and mitigate or navigate some of those negative assumptions that are being made that they might be unconsciously portraying or expressing when they're working with their team. If possible, hybrid working options. Do we have to be in the office every day if it's not a clinical role? Is that something that we could offer? And then thinking about how we challenge negative views, there really needs to be a huge culture shift, and we are seeing that in some ways, but we're, you know, from the data that we've already discussed, it's still not enough. So we need to proactively make sure that we're challenging these and being allies to others in the workplace. Next slide, please. So I really wanted to kind of, hopefully people can use this slide to really be positive and make sure that actually as a individual who may be experiencing this, or is someone in your team, share this, that, you know, we need to empower ourselves when we're in the workplaces. So we need to make sure we know our rights, find out what your rights are, look at organizational policies. Don't be afraid of asking about organizations' maternity leave policies and flexible working policies if you're going for a new role, because those things are important to you as an individual, and you need to know that the place that you're working for has those things and has considered those things. And if you don't know, then speak to a member of the human resources team. Think about when you want to take your annual leave. So in the NHS in the UK, you accrue all your annual leave and bank holidays. So can you utilize it when you come back? What does the organisation do? To make you feel like you're more in control, plan your handover, think about what you want covering when you leave and what will help for when you return. And in terms of coming back, we have keep in touch days in the UK that you can use. And so you can come back to work one day every so often. You decide with your manager just to touch base again, so you're not coming back completely cold after, say, perhaps 6 months off or a year off, depending on how long you've been away. And so that can be very helpful in just feeling like you've not completely lost touch of what's going on in the workplace. And be realistic. It's okay to say no, and you don't know what it's going to be like when you come back. So don't make any commitments that you don't feel like you can consider. Again, with childcare arrangements, you don't know what it's going to be like, and there's always government grant schemes, particularly we have in the UK, that might be able to support. And then from a very practical logistical GPHC, we have annual revalidation. In the UK, you don't have to submit the same number of entries, so it's worth finding out what you need to do just to keep on the register, and also make sure you're not putting too much pressure on yourself. Next slide, please. Thank you. So these are just some tips about asking for flexible working. That's one thing that's come up a lot in the UK about how do you feel comfortable asking for flexible working. It might feel very alien and uncomfortable, and especially if you might not get the working pattern that you want. It can feel like there's been a bit of a rejection. So in terms of being proactive, again, going in armed with all the information, think about what you want, and ask yourself what you would do if you were your line manager, and what kind of questions would you be asking. And so you can preempt all of those and go in with some solutions, and perhaps come up with some ideas of who will be there to do your role when you're not there, or what can be done differently. Don't rush, take your time and think it through, because it just saves that back and forth, and it's more of a negotiation and a discussion, but you are within your right to ask for this. Next slide, please. And also ask other people. There are other people out there that have done this before, who will be working in a similar way that you would like to. So get ideas from people about how they've done it and how they approached it, and that will help you kind of think of ideas of how to take this forward. As I said, it's a discussion, to see it as a negotiation, and again, just to protect yourself, make sure everything's in writing, so you've got that written down, and you know what has been agreed, and then surround yourself with support. And I think that's the key thing, that you're not alone in any of this, and we need to be supporting women, supporting each other, in building each other up, and making sure that we're taking each other forward and being in those senior leadership roles, and being in the workplace fully and flexibly. Next, I think that's the end of my slides. But oh no, sorry. And then just finally, again, I know this is from a UK perspective, but there might be useful resources or just ideas for everyone outside of the UK. But there's the Royal Pharmaceutical Society. As I mentioned, we did this campaign. We've got a number of blogs on our website that are free to access for everyone, even if you're not a member. We've developed a microaggressions reference, where we spoke to women and parents and carers who have shared their negative experiences, and we've produced a poster to say, these are the experiences people have had, why you shouldn't talk to people like this, and what you can be doing to be more micro-affirmative in this space. And that might be a very handy visual tool for people to recognize that their behavior is not okay. We have an inclusive network which people are free to join, and so you can more than welcome to join our meetings every 2 months, where we have discussions on various topics. And then thinking about mentoring and coaching, we actually have a mentoring platform that people can utilize in finding other people in similar positions that they may be able to access. If you're struggling, there's also trade unions that we have in the UK that you can join. We've got our government website and publicly funded bodies like ACAS that have a lot of information about pregnancy and maternity that you can read through in your own time. Workplace policies, and then charities which also provide additional support if you're struggling. There's one, Leaders Plus, which is actually an organization that does lots of stuff to support women in leadership roles, and I think you can access it internationally, but they have a huge range of podcasts on there from women doing various roles, leadership roles, who have all come back after being pregnant or going on maternity leave, or having more than one children. But it's a really great resource. So if you want just hear ideas of how they've done it, or inspiration, I would definitely recommend logging on to that website. But that's some resources are available in the UK if people were needing more information. But I'll finish there, and again, thank you for listening, and I'll take questions in the panel session after.
Thank you, Aman, for your presentation. Next, we have Lucinda Main talking. She is the Chief Executive Officer, Emerita, American Association of Colleges of Pharmacy in the United States. So Lucinda, I'd like to welcome you to do your presentation now. Thank you.
Thank you so much. I have really appreciated the opportunity to share this program with my colleagues. And I'm going to very quickly go through what I would call a case study in how the United States has addressed policies at the state and at the federal and at the organizational level. So the US picture. But first, the next slide, I'm going to start with a story of how back as late as 1998, I became aware of the fact, or 88, excuse me, that the United States had a dramatically different approach to maternal and paternal leave versus friends of ours in Sweden with whom we had the opportunity to visit in country at that point in time. And a woman who was hosting a barbecue in her backyard across the table from me asked, well, Lucinda, in the United States, when a woman has a child, how much time do they typically take for leave? And I thought about it. I had not had children by that point in time. Mine are adopted from in Russia in 1997. And I said, well, it's my impression that women will typically take somewhere between 6 and 8 weeks of leave after they've had a child. And her immediate reaction was, why would you even bother to have a child? And I learned at that point that in Sweden at that time, people could take up to a year of paid leave. And I've subsequently learned that not only can the mother take paid leave, but so too can the father or the other partner. And so the United States had quite a ways to go. Next slide, please. Today, however, I would have to characterize our policy as a fragmented puzzle of US and state federal policies. Next slide. This began to change back in the early 1990s, so almost 30 years ago, as more and more women were entering the workforce and that sandwich generation was becoming more common. And so the federal government enacted the Family and Medical Leave Act, and that granted 12 weeks of unpaid leave, which essentially secured the role that an individual who needed to take leave to provide either care for children or someone with disability or parents with increasing vulnerability. You weren't absolutely guaranteed that you would get your exact position back, but the federal law required that you would get an equivalent position back. But again, as unpaid time away, which is very difficult for many families. And FMLA only applied to organizations that employed 50 or more employees. Now, in healthcare, that would be probably the vast majority of individuals who are in management and or on the front line, because they are typically longer organizations. That applies to hospitals and health systems, corporate environments where pharmacists and other healthcare workers are working. In 2020, and I have to imagine this was compelled at least in part by the COVID pandemic, the federal law that still applies to 50 or more people was amended to provide 12 weeks of paid leave for individuals who needed to take an extended amount of time away. But in general, the federal government depended upon changes in state policies to influence how parental leave was covered either as paid, mandatory, or voluntary policies. And you can see, according to the Bipartisan Policy Center, that as of the beginning of this year, there were now 21 states in the District of Columbia that had paid leave policies. Of these, 14 are mandatory, 8 are voluntary and up to the employer, and 18 of those are currently in force with 4 in progress. So there's still a long way to go in the United States in order to get paid leave as a requirement for employers. We just have a ways to go. Next slide, please. Thought I would use my 20 years as the AACP CEO to talk about an organization that lives in the cracks of these state and federal policies. AACP has less than 50 employees, so therefore there's no federal mandate for time away or paid time off. Our office is in Virginia, that, as you would note, has a state voluntary paid parental leave system, which I believe is still in the implementation phase for 8 weeks of voluntary paid parental leave. AACP for a very long time has had a history of 6 weeks of paid maternity leave, which was changed about 10 years ago when a bold father-to-be came forward to HR and inquired as to whether or not he would be eligible for our paid leave policy. And so we, in fact, did change our policy to a parental leave that is equivalent for both men and women who are becoming parents for the first time or again, or have other reasons why they need to be away for a time. That said, AACP also offers a generous amount of accrued paid time off, plus short-term disability. And I would have to say that in my 20-year tenure as CEO, we had many men and women who added children to their families. And we maintained as flexible and family-friendly approach as possible. And I would say that the average individual would take 10 to 12 weeks of maternity leave, or probably a little less time of paternal leave. But sometimes they were able to sequence that so that a child could be tended by a parent at home for as much as 4 to 6 months of their first period of life. And I'm just going to close by saying, and I think it's notable that currently and for quite some time, all of the senior leaders of the American Association of Colleges of Pharmacy, men and women, were parents. Some had children in those executive roles, those leadership roles, and others also had parental care responsibilities. And so it was just our policy to be as flexible as we possibly could be. And with the pandemic, where we all went and we were all remote enabled, AACP, my successor made the decision with his team that they would remain remote enabled and with very limited expectations of returning on a full-time basis to the workplace. Still a work in progress in the United States, I would say. And my final slide just summarizes what you've heard from our previous 2 panelists. We do currently have many challenges facing individuals who need time and flexibility in their workplace, not the least of which is cost of childcare and its accessibility. We were fortunate that our older son, who was almost 4 when we brought him to the United States, had very close and affordable childcare in a very high quality place very close to our home. Not so for the baby. So there's age issues associated with availability of accessible and cost accessible childcare. Do remain current on laws and regulations, both at your workplace. Make human resources an ally to make sure you fully understand company policies and fair practices, and build yourself a support system with your coworkers as you consider building families. So again, my thanks to FIP for hosting this. I think this needs to be the first of a continuing series to make sure that we advance equity in the workplace as it relates to family care responsibilities. Thank you again.
Thank you, Lucinda, for your presentation. Now I'd like to invite everyone in the audience to share their questions. We've got the question and answer box, and asked if you have any questions for anyone on the panel based on their presentation or any other questions that have been stimulated through their presentations. If you'd like to share them in the question and answer box, and I can ask them to the panelists. In the meantime, while we wait, I might throw the odd question across as well. I guess I would say sometimes things don't always go right for pregnant women. So what laws are there to protect pregnant women, and what options do they have if things don't go right or if things go wrong in their workplace?
I'm just going to reflect on that from, again, the case study of one organization with approximately 35 employees. If we knew that a woman needed to have a bed rest, for instance, to secure her policy, we would apply every leave opportunity that we have at our disposal to support that individual. We do offer quality health care coverage, so hopefully that accessibility is not an issue, and a very generous paid time off policy that accrues on a monthly basis, 2 days per month from the first year of hire, up to 3 days per month after 10 years, which equates to 7 weeks of paid time off plus very generous holidays. So, but that's not probably the average workplace, but one that was focused on retaining our quality employees, regardless of whether or not they had parental or other health challenges to surmount.
I can provide, from a UK perspective, we have the Equality Act, which was established in 2010. And so underneath that, pregnancy and maternity is considered as a protected characteristic. So that means there's 9 protected characteristics under this Equality Act. And so we have to legally, organisations need to make sure that if you fall under one of those categories, there's procedures and policies in place to protect people. So particularly that under pregnancy and maternity, women would be protected. So if anything was to go wrong, we've got the Equality Act that makes it legally a legal requirement for organisations to protect women who are pregnant. Within the NHS, it's very well established. There's lots of guidance and policies. And I think because it's a nationally funded health organisation, it's something that's become quite normal. In private organisations like community pharmacy organisations, I think the support varies, but it's there because obviously it's a legal requirement. So that protects us from that perspective.
Thank you. I thought maybe I'd ask about your experiences with pregnant women looking for jobs. What have you heard, or what resources are there for pregnant women looking for jobs?
I can't imagine that in some environments it is not an impediment to being hired. But I am reflective on the progress that has been made over the course of my professional career, which spans 50 years now. Whereas prior to my generation entering the pharmacy workforce, as was noted, men would not hire women in community pharmacies because they couldn't work late hours. And in many cases, not only did women lose positions when they became pregnant, but they also, in some cases, lost those positions when they married because the assumption was that they were going to become pregnant. And so, in a way, I can say that we have come a long way. But I also have to reflect that we have a very, very long way to go to achieving all of the parameters that my colleagues described would be ideal in terms of the healthcare workforce.
Again, it's very similar from a UK perspective. There's going to be cases, and I think the problem with the role I do, people want to tell me all the negative cases. So I've probably been told more negative experiences than positive, because they're the ones that have been okay and have got the jobs and are thriving, whereas people come and tell me when it actually hasn't gone right. And so there are sadly still discrimination and biases, and obviously you can't say explicitly it's because they're pregnant. They'll find another reason. Their culture fit isn't there, or they don't feel like they were the right person for the role. And I think unfortunately people still have those experiences, and it varies sadly. And I think that's the issue, isn't it? That inconsistency and these things still happening.
Yeah, I'd like to add to what Aman just said. Actually, yes, we know the positive experiences maybe from ourselves and those close to us from people we know. However, the negative experiences still reside. But for pharmacy has long been known as a career very commonly sought by women. It offers flexible hours, and it allows some type of work-life balance if you speak about normal conditions. So it is really sad to know that pregnancy would draw some women out of their jobs. And I think that this should be very well regarded, and we still need to raise more awareness and to host many initiatives to make sure that these women are still treated on equal terms with male colleagues, even if they're going later to take maternity leaves.
Thank you. I still encourage the audience to put any questions and answers they have in the question and answer box, just to make sure that we make the most out of the opportunity with these great panelists to hear their perspectives and what's going on in their countries. But in the meantime, I might ask about reintegration programs. What happens in where you are when women come back to work following maternity, and how are they supported in their reintegration back into the workplace?
To generalize, I would have to say that it's probably very organizationally dependent. And especially for frontline healthcare workers who don't have some of the flexibility of working remotely, perhaps in all situations, and may be struggling with access to quality healthcare and childcare. And I do think that this is a place where senior executives really need to make sure that the supervisors of those individuals who are coming back have the right mindset about reintegration. And I'm remembering one situation specifically. We had a temporary leader in our communications group, and she was going to stay only a very short period of time while we looked for a permanent replacement. But both of the women who unit were expecting children, and one was going out almost as soon as this individual assumed her responsibility, the other one 3 or 4 months later. So we had a scenario where a whole unit was experiencing these transitions. And that senior leader specifically asked me if she could stay to make sure that those 2 staff members' transitions were successful, because she had had previous work experience reintegrating new parents and felt like she could make that transition as positive as possible for these 2 very valued employees, who, by the way, still work for AACP about 15 years later. So when the right attitude is in play and the right experience at the supervisory level, I think really good things can happen.
Yeah, very similar to what Lucinda said. It varies organizationally, and to your line, I think with your line manager as well, and the support that they may have previously experienced if they've undergone it themselves. They know how to provide that support, but it does vary depending on where you work. And actually, if you locum or you work in a temporary contract, you know, I think you're just expected to just go right in because you're there to deliver that service for that community pharmacy, for example. Whereas if you work more in a wider team, in a hospital, you do have a transitional period where you come in. And I think in theory, in practice, you might come in like 1 day a week and 2 days a week, but I don't know if the attitudes around in the teams expect you to be transitioning. You may be transitioning on a practical day level, but I think people expect you to log in and just run with the work that you've been doing before you left. So I think, again, it varies depending on who you work with and who you work for.
So I think it's about leadership is very important in this regard. I'm not sure about specific practices, but in addition to the flexibility in the working hours and the bit or relatively long leaves, I think that in some cultures, another important aspect that is given to women returning from maternity, which is needed in addition to the changes, the physical, the mental, and the emotional changes that these women face, I think the issue of nursing or breastfeeding should be taken into consideration as well. privacy needed maybe for private pumping of breast milk to allow like these women to thrive. Maybe reduced working hours so that nursing mothers are not for a long time away from their babies. I'm not sure how much this is applied, but I have seen it, and I think it should be very supportive, and it should advocate also for the act of breastfeeding as a general health, as a general healthy recommendation for women returning from maternity.
Thank you. I thought I'd ask about IVF because there are more and more women going through IVF, and that's even before they have to have the maternity discussion with their workplaces, but they still need time off, and there's still a lot of ups and downs with regards to the process. So maybe you could share some of your insights about the IVF process and women in the workplace.
Actually, I have encountered women through their IVF process for a long time when I was still a practicing pharmacist. And I can relate to the emotional and the mental challenges that are faced by these women. And as you said, Carleen, by the on and off situations they feel themselves going in. And I do understand that the IVF procedure could be very long and the trials could be very numerous for these women. And I could sense that for leaders, maybe it would not be practical, like to give a full time off for someone pursuing or planning for an IVF. But I think it's all about the culture and the mindset. So if I will have an employee who I know that is going through an IVF, and I'm a leader, I should be able to understand that on a Tuesday, this employee might need to leave early, even though it's still not weekend, because she is suffering from an emergency condition or something difficult has just came up. So I think it's about like maybe we cannot set rules for that, but it should be the flexibility in our mindset and in how we deal with these women and consider their special cases.
Thank you. Does anybody else have any insights for the IVF process and workplaces?
I think it just varies on an individual basis because it's quite a private thing as well. So people might not feel like they want to share, and it's making sure that you're creating that safe space for people to want to be able to share that information with you as a line manager, and maintaining that confidentiality because it can be quite psychologically scary and vulnerable. So it's about recognizing the need to create that safe space for people to have those discussions, and the emotional burden that comes with that and the emotional toil that it can bring. But I know from the conversations I've had, it's not very well understood by employers, and it's still something that we need to work
on. Okay. So I'll still encourage the audience, if they do have any questions, to please share them to make sure that we can get the best, to make sure that you get the best out of the webinar. And the panelists are here to answer any of your questions or the majority of your questions, but please put them into the question and answer box or into the chat box and we'll endeavour to answer them for you. How about adoption policies in the workplace? How have you seen those play out in real life?
Well, as an adoptive parent, I pay attention to that. And what I would have to say is that the current perspective is parental responsibilities and leave, regardless of the manner in which you add children to your family. And so in my case, there was no differentiation by my workplace, which wasn't actually AACP, but I worked for another association that actually was under FMLA because of the size of the organization. But again, very accommodating, very appreciative of the change in our lives. Now, I would also say that my husband was working, also a pharmacist, but he was working at home in a consulting capacity at the time that we brought the boys home. And so the younger child, who was less than 1 year of age, and had fewer options for quality childcare because of state and local regulation, he was able to stay home with his dad while mom went back to her association leadership position after after about a month, being 6 weeks total of getting the children to our home and then staying home to bond with them as a new family.
In the UK, you're entitled to a year, the same as a maternity leave. You're entitled to a year off work as statutory. And so employers need to follow that, which is great, I think, to be able to have that as an option. I think the challenges I know I've heard of are actually not once the adoption leave, but the things that you have to do beforehand. And I suppose a lack of understanding of how the process can vary, or the amount of appointments that you need with your social worker and caseworkers, and sometimes the urgency with which they pair the child and the parent, and everything, and the ups and downs with that. So again, from the experiences that people have shared with me, actually adoption leave policies are really well written and very well done. So it can be done when it, which is a great sign. But in the UK, you do get a year statutory that you're entitled to.
It was very touching that Lucinda shared her own experience. That's very insightful. Thank you, Lucinda, for sharing that. And I second the fact that it's not about the way the child is brought up, whether it is a normal maternity leave or an adoption leave. I think it's about the policy, which should be applied to everyone who has the privilege of being mom and dad.
Thank you. I might ask you an idyllic question. So if you got to do one policy change or one change that you think would make such a big difference for your local maternity leave policies in an idyllic situation, what would you implement?
Actually, for me, I would go for a flexible work schedule, because I think this would like give privilege to those women, and would at the same time keep them connected to work rather than not connected.
I think I'd like to see an expansion in both the term as well as the expectation that the employer would pay, not be unpaid leave time off, because that becomes fairly unrealistic for many families. And I think that the policy both to the mother, classically, to both parents, so that if, let's say, it was 6 months of paid leave for both parents, then you could theoretically have a year of time when that child is at home with a mother or another parent, and give that, both the bonding, the whatever the feeding expectations are, as well as give those people time to develop a plan for quality childcare for after their paid leave time is over.
I was going to say the same as Lucinda about having a fairer paternity family-friendly policy, so both equal. But what might be nice actually is it's very rigid. So in the UK, you have a whole year and you have to take that as one calendar year. But it might work better if you could take 6 months, do 6 months in the second year, or something that works more flexibly. It's very, very strict. So having a bit more flexibility with that would be great, as well as having more time for the father, maybe in a traditional setting, but the other parent to be able to have as much time at home as well.
Just gotten a question through, so I'll share that with you. How long must one be on maternity leave before getting back to work for the women, and also the ideal length of time for paternity leave?
So if I'm interpreting the first part of the question correctly, there actually is no mandate about shortening the amount of time that you allocate for yourself within the context of the policies. Your country, your origin, I'm sorry, or your organization. And I think we both have addressed what we would think would be an ideal scenario in terms of, in total, about a year, with some flexibility built into it, where there's equal opportunity for both parents to have paid time off with a new child, whether adopted or by birth.
So I might ask you the final question. So what advice would you each give to women in the field, to other women in the field, whether in leadership positions or those who are looking to be employed?
For women in leadership positions, I would say put yourself in the shoes of the mother and think about what she is passing through, and be the servant type. Give her flexibility and give her the ability to assume that she can take that time off because she needs it for her child. For the employee, I'd say empower yourself and discuss your priorities. Prioritize what is best for you. And keep in mind that once you have become a mother, you will stay a mother for your whole life. So prioritize again. Keep the mother side with you, but at the same time, do not forget your career growth. And do not allow motherhood to be a barrier, but rather consider it a chance to empower yourself.
I think it's really critical that leaders within our organizations make these policies as clear, as transparent, that they be discussed in group settings, so that everyone understands what they have access to, and that it is administered accurately and fairly, and then hold the organization accountable as an individual, be empowered, and make sure that your rights aren't violated wittingly or unwittingly as you enter into the blessed opportunity, should you choose to do so, to become a parent.
Adding on to the great advice that Dalal and Lucinda have already given, that's thinking about the skills. I think parents who have become parents and they don't think about themselves, they're off work, but there's lots of transferable skills that you bring back into the workplace that you perhaps didn't have beforehand. The organization, thinking of multitasking and everything that goes along with being a parent. And so you've come back upskilled in a different way, and actually how can you use that in the workplace? And I think that's also the same for employers and managers. Don't write people off because they've been off work. They've done a lot in that year, and how can we utilize their skills in a different way that they're bringing back, that they've perhaps had, and continue to work on. I'm not a parent myself, but I work with parents, and the things that they do which take me perhaps an hour, they've done in instantly, because they're thinking about things all the time. So back yourself, because you're coming back with new skills, and absolutely you belong, and you should be thriving.
Thank you so much. And I'll ask if there's anything else the panelists would like to share. If not, I will thank you so much for all of your presentations. It was very insightful, and I think the audience has gained a lot of perspective, both from their own personal lives and also how they want to interact with their additional colleagues who would have maternity or paternity considerations. So thank you so much for sharing your insights and your experiences, and what goes on in your countries. And hopefully everyone can bring that back and be motivated to make some changes and positively in their workplaces with their colleagues as well. So thank you so much for your presentations tonight, and thank you so much for answering all of the questions. And then I'd just like to remind everybody that the FIP has its Congress coming in Cape Town in Africa on the 1st to the 4th of September. So please register and look into it, because it'd be great to have you there. Thank you so much.